we did a retrospective study where we went through all the cases that were managed at Sultan Qaboos University Hospital between March 2016 to July 2017. The second part of my study was a survey that was conducted among emergency care physicians just to evaluate their knowledge about scorpion sting management. So basically what we found is that the total number of scorpion sting cases were almost 128 cases. The majority were adults, almost 84.4%. However, 15% of them were pediatric patients. 75% were males and 25% of them were females. So we also looked into the clinical features and the presenting complaint of these patients, and we found that the majority of them presented with local symptoms. Almost 97.7% had pain, and a small amount of them had systemic symptoms, with tachycardia being the most common presentation. And this is explained because the scorpion venom is known to release cytokines and neurotransmitter that increases the heart rate. So we also looked into the lab investigations that were done for those patients. And the reason why we looked into those lab investigations was that we wanted to focus on bedside clotting tests. Because bedside clotting test is not very relevant, especially that most of the scorpion species in Oman would not cause any coagulation derangement. So we found that bedside clotting test was done for 11 patients. However, all of them had normal bedside clotting test. The most common known species that causes actually coagulopathy
delivery, and the infant will be vaccinated as the normal other infants are vaccinated. Okay. In case if the mother is HBS positive, that is hepatitis B virus positive, in that case, immediate firstly, it's better. What I have seen practically that the surgeon goes or gynecologist go for the cesareans. They say in that case there's a lesser chance of because during the delivery the child engulfs all the fluids of the mother, so probably they may be infected during the delivery, so they prefer to go by cesarean, and immediately they give the HBS immunoglobulins, and later on the vaccination, like that is the normal vaccination in which we give the genetic recombinant form proteins of HBsAg to the patient with the normal schedule. You can give it to them, but immediately you have to provide the immunoglobulin, so that if the child has by chance encountered with the infection, it could fight back to it.
Yeah, Aurelia. B-A-B-R-E-J.
Pebreja. Dr. Pebreja completed his medical program from Armed Forces Medical College, India in 1990, followed by internship at Darjam Hospital, New Delhi, having worked
High dose vitamin C. I think a little elaborative, and my job right now is to make sure that none of you sleep. So, postprandial hypoglycemia is very common. So, I hope I can keep you awake. So, this is the topic: role of high dose intravenous ascorbic acid, which we term HDIVC therapy in cancers. Cancer, as we know, we have seen through our practices, there are a multitude of treatments offered, but somehow hardly patient survives a particular time range, 5 years, 10 years down the line. There are survivors, but yes, in the main, there are very few. So here the two key points which I would like to focus is on high dose. What is high dose? And second is, why intravenous? Why not oral? So as we will see in our future slides, we have answers for both. So first of all, what is the normal dose of vitamin C? It is seemingly a very, very innocuous kind of a vitamin, although so important for the body. And the recommended daily allowance is 60 milligrams, 90 years plus, and oral. In normal blood, when we do the vitamin C levels, I don't know how many of you have in their countries vitamin C level available as a test, but yes, when we do the vitamin C levels, we find the normal ranges are 0.7 to 1.4.
Interesting presentation. I have two short questions. Any risk for tumor lysis with high dose IVC? And the second question, which cancer is more risky with low level of vitamin C? Is it blood or solid tumors?
I have to actually understand your question. I could not.
The second one?
Yeah. Question number one.
Number one?
Yeah.
Any risk for tumor lysis syndrome is using
Yes.
high dose?
Yes.
And the second question, the low level of vitamin C risk for the cancer. Which cancer is more risky? Is it bloody, like leukemia, or the solids?
All right. The first question, where we want to see the high dose IVC bad effects. Yes, Hersheimer reaction has been seen. As soon as you have initiated the dose, the cancer cells lyse and they release endotoxins. That goes into the blood and it gives you a reaction which involves sweating, pimples, flushing of skin, and sometimes even drop in blood pressure.
So we have to use hydration and medication.
Yes, exactly. We always run a NS when we are doing this stuff. And the second question, I have to understand.
Is it the low level of vitamin C risky for the bloody tumors or the solid? Or
Okay.
no study regarding that?
Blood tumors have responded well compared to the solid tumors.
Not the response, the cause. The most cause is by
Cells,
high dose.
on the high dose,
This high
I
dose.
told you they have catalysts. Normal cells have good amount of catalysts. They will metabolize any amount till you have crossed, an exorbitantly high, which we have not discussed. Of course, they have the ability to digest any amount of, by which I mean 50 to 100 grams of. Normal cells don't get affected by vitamins, high dose vitamins. That's the beauty of this.
And secondly, with this catalase is basically an antioxidant enzyme.
Yes.
I'm not sure what you were trying to suggest about method to measure it.
Yeah.
Because there are methods to measure it, but there is no guideline for a normal level.
All right.
Because you do spectrophotometry, you do HPLC, you can get catalase values. But
Okay.
whatever values come as per the various methods are standardized.
Uh-huh.
So we don't know whether the value is less or more unless you compare it with a normal patient value.
Yes, I agree with you. In fact, if you do it in a patient who, as a control, you can use a normal patient, and then you have a cancer patient who already have low catalase activity. When you challenge the cancer patient with a high dose of vitamin C, and you look at the catalase levels, you will always find them far lower, or maybe none compared to the control.
Yes. Definitely less than even your serum or your saliva, everything. So it's less levels.
Less level.
Thank you for the beautiful presentation. For the treatment plan,
Yes.
irrespective of the type of cancer, do you have the same
They show you the people use celery juice to do the detoxification. So they have the same problem after you use the celery juice, have the pimples and the flare up on face.
Right.
So is there any similar mechanism between these two, ascorbic acid and celery juice?
I have actually, I won't be able to answer this question because I don't know the vitamin C contents of celery juice, but definitely it's very rich in vitamin C. I don't know about it, but if it is rich, oral absorption, the gastric absorption can induce a similar situation when you are using it in a cancer patient.
Thanks for your beautiful presentation. I have just about many questions, but to find out whether there's any documentation so far. Since high dose of vitamin C can help to encapsulation of the tumor, the reduction in size,
Yes.
and also stabilizing the cancer cell.
Oral cancer.
Yeah. Is there any documentation of whether normal dose of vitamin C, if it can maybe help in the prevention of cancer, that is the possibility of
No,
cancer?
there is a study which shows vitamin C has no role in prevention of cancer.
But high dose will.
Yes, because you achieve higher levels as we have shown in 350 to 450 milligrams, which both in lab studies, animal and cancer cell line studies, as well as in human studies, have shown to be cytotoxic.
Dentistry. She has 20 international and national publications in in-depth journals to her member of editorial board of Journal of Health Science and reviewer for various international journals. She's the life member of Indian Society of Periodontology and Indian Dental Association. Currently, her research focus is on treatment of peri-implantitis and treating oral lesions through ozone. Her field of specialization include laser and regenerative therapy, which includes her harvesting growth factor from blood.
Thank you, Paul. And it's a particularly concern for the healthcare workers. So who are these healthcare workers? They are defined as all people or persons whose activities involve contact with patients or with blood or other body fluid from patient in healthcare or laboratory setting. They are also persons with potential for exposure to infectious material like blood, tissue and specific body fluids. They include physicians, nurses, dental personnel, laboratory personnel, students, trainees, and all those who are involved with patient care. Approximately 3 million healthcare workers experience percutaneous exposure to blood-borne viruses every year, and this has resulted in an estimated 16,000 hepatitis C, 66,000 hepatitis B, and 200 to 500 HIV infections annually. More than 90% of these infections occur in low-income country, and most are preventable. Studies have shown that in high-income countries, with the use of preventive measures, the incidence is reported to be low. In contrast, the healthcare, the situation of healthcare workers in the low-income country is poorly documented. This table provides an estimate of the risk of HIV transmission through different routes. The three major routes being blood transfusion, perinatal, vertical exposure, and
Thank you for good presentation. Any post-exposure prophylaxis for those, like if you have patient receiving blood transfusion now and you get information the blood is contaminated with HIV, any post-exposure agent, and for those with sexual contact, I mean like emergency prophylaxis for contraceptive for agent within 72 hours.
Yeah, it is shown that the fluid that is available, the combination that is available as tenofovir and amitriptyline, if there is an exposure, then if it is taken within 72 hours, it is shown to be effective. It is available as such in the market.
And also for the blood transfusion?
For blood transfusion?
Yeah.
Yes, yes. It should be taken within 72 hours, that is what they say. Whatever source it may be.
What's the nurse burnout rate like in India?
Pardon?
What's the nurse burnout rate like?
I didn't get your nurse.
What I meant is,
Good afternoon, everybody. So the topic of my presentation, as you can see here, is the early assessment of the intrarenal arterial resistive index and the long-term renal function in renal transplant recipients in southwestern Nigeria. The word of introduction, mainly the CKD, that is a chronic renal disease, is a progressive loss of glomerular function caused by long-standing renal parenchymal disease, which mainly in ultrasounds. As I told you, I'm a radiologist. We grade it in four ways. Like grade 1 is when you check with ultrasound the echo texture or maybe the color of the kidney is the same with that of the liver and spleen. That is with preservation of the corticomedullary differentiation. That is the difference between the collecting system and the cortex. They are the same. Then that's grade 1. Grade 2 is when they are the same. That is, you check the corticomedullary differentiation is higher than that of the liver and spleen, but with preservation of the corticomedullary differentiation. Then grade 3 is when the color or echogenicity of the liver, of the kidney is more than that of the liver and spleen, with associated loss of corticomedullary differentiation.
This machine itself has inbuilt module to calculate the resistive index.
Yes.
Do you like antiastenic volume? When you look at the calculation, it also looks at the echocardiographic values also.
That is the calculation of the resistive index. Using that of the machine and calculation.
Yes. How does the machine calculate all the values? From the renal artery pulsations only, or?
As I said, the machine calculation is very okay, because we have done the machine calculation, then you do it manually and calculate. We almost get the same value. The only difference may be something like 0.1, which is not significant. So, and even the pulsation of the arteries, you put and you see the artery pulsating, while that of the vein is not pulsating, not pulsatile. The vein is not pulsating, while artery is pulsating. And that will help you to know that this is artery and this is vein. And the veins are always bigger than that of the artery.
Thank you.
Facial pathology and microbiology. BYWS Dental College and Hospital in India. She joined the above-mentioned institute in 2014 and started her specialty oral and maxillofacial oncopathology center in Amravati during the same year. She has 17 international and national publications in index journals to her credit to date. She is the first one in the literature to give phenomenon of cellular cannibalism in dental chronic